Okay, let's unpack this. There's a narrative around aging that often feels, well, quite narrow, doesn't it? It tends to focus on decline, on what's lost, things winding down. It's a story I think many of us are fed, consciously or unconsciously, but what if we told you that perspective is far from complete, and maybe even a bit misleading? The reality, as we've discovered diving deep into a really fascinating stack of sources, it's incredibly diverse, it's dynamic, and it's full of surprising opportunities that often just get overlooked. Today, we're embarking on a deep dive into the multifaceted landscape of aging right here in the United States. And for this exploration, we've pulled from a remarkably broad range of materials. I mean, everything from the official guides, like the Medicare handbooks, those detailed U.S. Census Bureau reports,
Yeah.
all the way to insightful lifestyle articles looking at everything from new hobbies and health strategies to cutting-edge smart home tech. It's really designed to be a truly comprehensive look, tailored to give you the most actionable and honestly surprising insights.
Yeah, and what's truly fascinating here, what we really want to bring out in this deep dive, is just how much actionable information there is. Stuff to help us navigate the realities of getting older. Whether you're planning for your own future or maybe supporting loved ones, we're talking about everything from, understanding the complexities of health services and financial considerations to nurturing mental well-being and maintaining a truly vibrant life. It's far more nuanced than the common assumptions suggest, right?
Absolutely.
So our mission is basically to extract the most important nuggets of knowledge from this whole stack of diverse sources, helping you become truly well-informed about the challenges, but also, crucially, the surprising opportunities that come with age. Let's jump in. So to really get a handle on the journey of aging in America, we first need to understand the fundamental demographic shifts, the ones reshaping our society. One of the most significant changes we're seeing, often called the graying of America, is just the sheer growth in the older adult population. Think about this. The U.S. Census Bureau projects that by 2035, the number of older adults, well, it's actually going to outpace the number of children.
Wow, that's a major shift.
It is. And it isn't some fleeting trend. It's a profound national transformation. It has huge implications across every sector: healthcare, the economy, urban planning, the workforce, everything. Now, here's something else our sources highlight, and it's a bit concerning. Despite significant past progress in extending lifespans, the overall improvement in longevity in the U.S., it's noticeably stalled in recent years.
Stalled? How so?
Well, basically, life expectancy in the U.S. stayed pretty flat for the decade leading up to the COVID-19 pandemic. Meanwhile, other advanced economies, they kept seeing increases.
So it's not like we hit some biological limit.
Exactly. That's not what the data suggests. Instead, this stagnation is particularly pronounced for young and middle-aged adults. They've experienced specific setbacks. The data points to increases in deaths from what are called external causes, specifically things like gun violence, vehicle accidents, and drug overdoses.
That's sobering.
It really is. And the rise in drug-related deaths among adults 65 and older is particularly stark. It increased by a staggering 51% between the 2017-2019 period and 2020-2022. We're talking nearly 20,000 drug deaths in that latter period for this age group alone.
Gosh.
So this nuanced pattern shows that while we've made strides in some health areas, there are significant public health challenges impacting not just how long, but also how well Americans are living across the whole lifespan.
And these demographic shifts, they aren't just numbers on a page, are they? They have very real, tangible economic implications, rippling through communities, states. Our sources dive into how this population aging impacts economic growth, especially at the state level. The research suggests that a 10% increase in the share of the population aged 60 and older, well, it can lead to a notable decrease of 5.5% in GDP per capita.
5.5%, that's not insignificant.
Not at all. It's a major economic shift we really need to understand and, frankly, prepare for. So why does this happen? The analysis points to a few compelling reasons. It can significantly impact overall labor productivity, employment rates, maybe even the total number of hours worked across the economy.
Right, because the proportion of older adults is growing relative to the working age population.
Exactly. It's a fundamental shift in the composition and, I guess, the capacity of our workforce. And to illustrate this, there's this concept called the old age dependency ratio. It's pretty important here.
Can you explain that ratio a bit?
Sure. It measures the number of individuals aged 65 and older for every 100 people who are considered working age, so between 20 and 64. And our sources project a significant increase in this ratio. It was around 25 back in 2020.
Okay.
But it's projected to climb somewhere between 35 and 40 by the year 2050.
Wow. So nearly 40 seniors for every 100 working-age people by mid-century.
That's the projection. And this rising dependency ratio connects directly to the increasing demand for long-term care services. That's a massive economic consideration in itself. But it also really highlights the critical need for continued investment in children's welfare.
How do those connect? Children and the aging population?
Think of it this way. If children grow up in poverty without good support or resources, they face more hurdles in health, in education. And that directly impacts their ability to become productive, high-contributing members of the workforce later on.
Ah, I see. So healthy kids become productive adults who support the economy.
Exactly. And our sources argue compellingly that those adults are the ones who then, in turn, support the economy and an aging population. They mention, for example, how the failure to renew the expanded child tax credit back in 2022, it caused 3 million kids to fall into poverty.
Oof.
Yeah. It's a stark reminder of how disinvesting in kids can be a costly policy error, especially with an aging population where we increasingly rely on better labor productivity. So here's that analogy. Think of our national economy as a large ship. The age and the well-being of its crew members, that significantly impacts its speed, its trajectory.
And we're seeing a shift in that crew composition.
Clearly, a shift we need to actively manage and plan for,
Yeah.
making strategic investments today for a stronger tomorrow.
Looking at this broader picture, it's really clear that the care economy is just vital, but often vastly underestimated, right?
Oh.
Part of this whole economic landscape. Our sources provide some really fascinating details here that just underline its importance. The care workforce in the U.S., it's immense and incredibly diverse. You've got over 37.1 million unpaid caregivers, typically family, friends, neighbors.
Right, the invisible army.
Exactly. Working alongside about 4.7 million paid care providers. But the economic contribution of those unpaid family caregivers, it's absolutely staggering, almost invisible in plain sight. In 2021 alone, their unpaid care was valued at, get this, an astounding $600 billion.
$600 billion with a B.
With a B. It's not some small side note. It's a massive informal sector that underpins so much of the support for older adults. It prevents countless people from needing more costly institutional care. And what's more, women make up the majority of this care workforce, which highlights a significant gender dynamic.
With implications for their own financial security, careers.
Absolutely. Organizations like AARP are really vocal advocates for supporting these caregivers. They emphasize the critical need for policies like paid leave, tax credits, respite care programs. And this isn't just about compassion, though that's important. It's about recognizing and sustaining a workforce, providing an invaluable, often invisible, service.
Yeah, without that foundational layer, the formal healthcare system would be completely overwhelmed.
Totally. It underscores the urgency of providing real, comprehensive support to these essential caregivers who literally keep our society functioning.
Okay, so we've set the stage. Profound demographic shifts, big economic implications. But what does all this mean for your day-to-day? As you or someone you care about navigates getting older, let's zoom in on the practical stuff. Health services, housing, those critical financial puzzles that always seem to pop up. And for many, the essential guide to all of this really starts with Medicare. When you think about Medicare, it can feel like this labyrinth, right? All these parts and plans. But at its core, it's our national health insurance program for people 65 plus, certain younger folks with disabilities, and people with end-stage renal disease. But maybe the biggest aha moment for many isn't just what it covers, but how easily small oversights, like delaying enrollment, can end up costing you significantly over time. Oh, that's a huge point about navigating Medicare. It's not just about qualifying, it's about avoiding those hidden financial traps. Let's try to demystify it a bit. So you've got Original Medicare, that's managed directly by the federal government. This has Part A, which is hospital insurance. Covers things like inpatient hospital stays, skilled nursing facility care, hospice, some home health.
Okay, Part A, hospitals.
Right. Then there's Part B, that's medical insurance. Covers doctor services, outpatient care, medical supplies, preventive services. And Part D is your prescription drug coverage. That's usually through private plans approved by Medicare.
Got it, ABD.
But then you also have Medicare Advantage plans, often called Part C. These are often by private companies, approved by Medicare, of course. And they bundle Part A, Part B, and usually Part D. And they often entice you with extra benefits, vision, dental things. Original Medicare typically doesn't cover.
Ah, so that's the trade-off maybe, the private versus federal management.
Kind of. The key distinction is, with Original Medicare, you generally choose your doctors and hospitals that accept Medicare. And it pays, typically, 80% of the Medicare-approved amount. after your deductible. You pay the other 20%. With Medicare Advantage, you're often working within a network of providers. Your costs, your benefits, they can vary quite a bit between plans.
Like PPOs versus HMOs.
Exactly. A preferred provider organization, or PPO, might let you go out of network, but it'll cost you more. A health maintenance organization, HMO, usually requires you stay in network, except for emergencies. So different structures, different choices.
And when it comes to what Medicare actually covers, there are some important specifics people should probably know. Like preventive services, it covers vital things like colorectal cancer screenings, flu shots, so crucial for staying healthy, catching things early.
Definitely. Don't skip those.
And if you have an injury or sudden illness, emergency department services are covered, though you typically pay a copayment and a percentage of the doctor's services. Something that often changes, and I think trips people up, is telehealth.
Yes, the virtual visits.
Right. It's been very flexible recently, but the rules are always evolving. So it's really vital to check Medicare.gov for the latest on what services you can get from home versus needing to go into a facility.
Good tip. Always check the source.
Okay, what about skilled nursing facility care?
Medicare does cover this, but there's a key condition. It has to follow a minimum 3-day medically necessary inpatient hospital stay related to an illness or injury.
Okay, so you have to be admitted to the hospital first for at least 3 days.
Correct. And here's a common misconception. It typically does not cover non-medical long-term care, like custodial care, help with daily activities. That's a major difference people need to understand.
It's a huge distinction. What about hospice?
Hospice care is covered if a doctor certifies you're terminally ill with a life expectancy of 6 months or less. The focus there shifts entirely to comfort care, managing symptoms, rather than curative treatment.
And thinking about cognitive health.
Good point. Medicare now covers cognitive assessments to look for signs of dementia or Alzheimer's. And if impairment is suspected, it covers a separate visit for a more thorough review and to actually design a care plan.
That seems really helpful for families.
It is. And there are even transitional care management services covered after an inpatient stay. This helps you and your caregiver coordinate your care for the first 30 days after you get back home. It's a huge benefit for continuity, making sure nothing falls through the cracks.
Managing the costs of original Medicare is another big piece of the puzzle, right? That 20% coinsurance for Part B.
Yes, generally you pay 20% of the Medicare-approved amount for most Part B services, after you meet your deductible for the year. And yes, there's a monthly premium for Part B that most people pay. A neat detail for convenience, though. You can pay your premium bill online through your secure Medicare account, use a credit card, debit card, even an HSA card, or directly from your checking or savings.
Makes it easier than waiting for the mail.
Much. It's often the fastest way, and it's free. And here's a surprising fact from our sources. By signing up for electronic Medicare summary notices, getting them online, instead of on paper, people saved the Medicare program close to $42 million as of late 2024.
Wow. Just by going paperless?
Yep. A small change that makes a big collective impact. It adds up. Now, this raises an important question, one that often comes up. When you have other insurance like retiree health coverage from a former employer or maybe Medicaid, how does that coordinate with Medicare?
The who pays first.
And what are the rules? This is where it can get really complex. The payment hierarchy, who's primary, who's secondary, it's incredibly nuanced depending on the specific types of coverage you have.
I bet people make assumptions that cost them.
Absolutely. Like assuming retiree coverage will just pick up the tab if you don't sign up for both Part A and Part B when you're first eligible. Or another one, if you have a health savings account, an HSA, you have to stop contributing to your HSA the month before you turn 65 or actually 6 months before you apply for Medicare to avoid a tax penalty. These seemingly small details, they really matter for seamless coverage and managing your finances effectively.
Exactly. Those details can add up to significant unexpected costs or coverage gaps. It's also really vital to be aware of the penalties for late enrollment, especially for Part D, the prescription drug coverage.
Oh, the Part D late enrollment penalty, yeah.
The penalty is calculated based on a percentage, specifically 1% of the national base beneficiary premium for each full month you were eligible but didn't have Medicare drug coverage or other credible prescription drug coverage.
And that gets added to your monthly premium.
Yes, it gets added to your monthly Part D premium, and it can fluctuate each year because the national base premium changes. So enrolling on time is really key to avoiding higher costs that could follow you for years and years.
Okay, so navigating Medicare is step one. But building on that, choosing a nursing home, that's another critical area where making informed decisions is just paramount. Our sources really emphasize the absolute importance of doing thorough research. And whenever possible, making in-person visits. Don't just rely on a glossy brochure.
Right. You need to see it, feel the atmosphere.
Exactly. Imagine you're stepping into a nursing home for the first time. What should you really be looking for beyond, the nice lobby? Our sources suggest asking questions that get right to the heart of daily life and the actual care provided.
Like what kinds of questions?
Well, for instance, ask, how are residents involved in setting their own care goals? Do they feel heard? Do they have agency in their own care? How does the nursing home arrange transportation for medical appointments? That's a practical but crucial detail. And, critically, staffing levels. What are they like? How many staff are assigned per resident during the day, overnight, on weekends? What's the average number of residents each nurse aide is responsible for?
Those ratios seem really important for quality of care.
They are. You should also inquire about what rehabilitative services they provide. What happens in a medical emergency? And, maybe most importantly, how can you report concerns about care or other issues? And will they tell you what was done to address them? Is there a clear process? And don't forget quality of life things like dietary options. Do they accommodate special diets? Low salt, no sugar added. How does staff help residents eat and drink if needed? Is there a policy about bringing in outside food and drink? Are snacks available 24/7?
Little things that make a big difference in daily comfort.
Huge difference. Are there amenities like a microwave and refrigerator residents can use? These might seem like small details, but they really impact daily life and reflect the facility's commitment to resident comfort and dignity.
You mentioned research. Is there a good tool for that?
Yes, a really powerful tool is Medicare.gov, Care-Compare. It's the official government site. It lets you search for and compare nursing homes in your area. You can review their health and fire safety inspection results, check their staffing levels, look at specific care elements like, did residents get their flu shots?
So objective data.
Right. And it also lists any penalties the federal government has issued against the nursing home. This info, combined with your own visits and observations, is invaluable. What's really striking is that each nursing home on Care Compare gets rated on a scale of 1 to 5 stars.
Ah, the star ratings. I've heard of those. Yeah. 1 star means the quality is much below average. 3 stars is average. And 5 stars means quality much above average. And this overall rating, it's a composite. It's based on combined ratings for health inspections, staffing levels, and quality measures. It gives you a pretty comprehensive snapshot to help you filter and prioritize your options to find the best possible care.
That's incredibly helpful.
Now, while nursing home care is absolutely a vital option for some, many older adults express a really strong preference for aging in place.
Staying in their own homes.
Exactly. Staying in their own homes or communities for as long as they possibly can. And it's not just a preference. There's often a significant financial incentive, too. Our sources highlight this stark cost difference. A private room in a nursing home, it can average over $105,000 a year.
Wow, $105,000.
Yeah. Compare that to the often significantly lower cost of care provided at home and in the community. You can see why aging in place is often a very attractive and frankly more sustainable option for many families.
So if someone wants to age in place, what resources are out there to help make that possible?
Great question. The Elder Care Locator is a fantastic starting point. You can call them. The number is 800-677-1116 or visit their website. They help you find local resources for things like in-home help, transportation services, and really crucial info about paying for care.
Okay, Elder Care Locator. Good one.
For meal support, Meals on Wheels America is just a critical service. They deliver nutritious meals directly to seniors. Their number is 888-998-6325. And many local governments also provide low-cost or even no-cost meals through senior centers or other programs.
And what about help around the house personal care? Right, so home health services are another key component. They offer assistance with personal tasks, household chores. Now, these services typically charge by the hour. Medicare has pretty limited coverage here, usually only for short-term medically necessary care provided by certified agencies.
So not ongoing custodial care.
Generally not. Medicaid also provides some coverage, but it varies a lot by state. And most private health insurance plans, they usually don't cover these long-term home care costs.
So you might be on the hook for a lot of it.
You might. You could be responsible for costs not covered by these programs, which is a major financial consideration. It really is about bridging that gap between the desire to age in place and the practical reality. Ensuring you can stay comfortably and safely in your own home, but it often requires really careful financial planning.
Yeah, that financial piece seems unavoidable.
Definitely. And looking at the broader financial landscape, it's clear that healthcare costs remain a major challenge. even for older Americans who have insurance. The numbers are quite stark. A recent West Health Gallup survey found that over a third, 37% of adults aged 65 and older are concerned, worried about being able to pay for needed healthcare services in the next year.
Over a third, even with Medicare.
Even with Medicare.
Yeah.
And that concern is even higher, 45% for those aged 50 to 64, the ones not yet Medicare eligible. That highlights a significant pre-Medicare financial burden.
Yeah, that gap between employer coverage ending and Medicare starting can be tough.
Very tough. And this financial stress, it impacts nearly 50 million adults aged 50 and older. It puts them at risk for more severe illness, even premature death, simply due to the cost of health care. It really underscores that even with a program like Medicare, the out-of-pocket expenses, the deductibles, the coverage limitations, they can still create significant financial burdens.
It's like a silent enemy.
That's a good way to put it.
Yeah.
This financial stress around healthcare costs can become a silent enemy to overall well-being. Even for those with insurance, it potentially forces people to delay or skip necessary medical care. And this isn't just a personal issue, right? It's a critical societal challenge impacting public health, economic stability. It reveals gaps in our safety nets.
Okay, so shifting gears a bit,
Yeah.
but still under health and well-being. Let's talk about mental health and social connection. These are absolutely crucial as we age. Our sources really highlight that social isolation is a serious issue for older adults.
It really is, and often overlooked.
It can lead to functional decline and significantly to depression, which impacts overall quality of life dramatically. And there are factors that often worsen this isolation, right? Like the profound loss of friends and family, changes in living situations, maybe the inability to participate in activities that were once cherished, things that provided that social glue.
Yeah, mobility issues, health problems can all contribute.
And the statistics around depression, they're quite striking. They really underline this vulnerability. For instance, depression rates vary significantly depending on disability status. Get this, it's 4.7 times higher among older adults who report difficulty with cognition.
4.7 times higher.
Yeah, reaching 44.3% for that group, compared to just 9.5% for older adults without a disability.
Wow. That clearly shows that deep connection between cognitive impairment, social factors, and mental health.
Absolutely. It underscores the need for really integrated support. And this year's Older Americans Month theme, Powered by Connection, it really emphasizes the importance of all sorts of supportive connections, with friends and family, whether that's in person or online, with the community through classes, senior centers, maybe faith organizations. And our sources even mention tapping into the benefits of connection with pets.
Pets can make a huge difference for companionship.
Definitely. And the sources also suggest that primary care clinicians, they have a vital role to play here, actively discussing loneliness with their older patients, providing resources to help them build and maintain those meaningful social relationships.
That proactive approach from doctors is key. But this raises an important question. Are we really doing enough to integrate mental health support into routine care for older adults, especially considering these complex social and cognitive factors?
Seems like a big challenge.
It is. And the current reality presents significant challenges, particularly when you look at the workforce dedicated to geriatric care. We are facing a growing gap. The older adult population in the U.S. is rapidly outpacing the number of geriatric clinicians available to meet their complex, specialized needs.
A shortage of geriatricians.
A significant one. Projections estimate a shortage of nearly 5,000 geriatricians by 2030.
5,000. Wow.
And this isn't just about a doctor shortage in general. It's about a deficit in specialized care. Care for the complex, multifaceted needs that often come with aging.
So what's being done, or what's proposed?
Well, several solutions are being explored. Things like training nurse practitioners to perform more outpatient care for older adults, investing more significantly in training programs, ensuring that medical school curricula and residency programs actually dedicate adequate time and attention to geriatrics.
Making it a priority.
Exactly. And offering financial incentives, things like loan forgiveness, scholarships for students who choose to specialize in this really vital field. The big goal here is to strengthen a workforce that's truly well-equipped, one that can provide comprehensive, integrated care for the physical, mental, and even substance use needs of older adults, shifting from just reacting to problems to a more proactive model of care.
That makes sense. Now, shifting to another critical and often sadly hidden challenge,
we need to talk about elder abuse.
Mm.
Our sources make it really clear that certain factors make older adults particularly vulnerable. Social isolation, which we just talked about.
Right, being cut off makes someone an easier target.
And mental impairment, things like dementia or Alzheimer's disease. Shockingly, recent studies indicate that nearly half of those living with dementia have experienced some form of abuse or neglect.
Half. That's horrifying.
It is. And furthermore, interpersonal violence happens at disproportionately higher rates among adults with disabilities. It points to a systemic issue of vulnerability.
So, what should people look for? What are the warning signs? For themselves or for loved ones?
Good question. In terms of physical abuse, neglect, or mistreatment, you want to watch for unexplained bruises, pressure marks, maybe broken bones, abrasions, or burns, especially if they're in unusual spots or patterns. For emotional abuse, the signs might be more subtle. Unexplained withdrawal from normal activities, a sudden change in alertness, unusual depression, or noticeably strained or tense relationships with caregivers.
Things that just seem off.
Exactly. Financial abuse could show up as sudden, unexplained changes in money situations, large withdrawals, new joint accounts, unexpected changes in wills or beneficiaries. Neglect. That's indicated by things like bed sores, unattended medical needs, poor hygiene, or unusual weight loss.
Signs that basic needs aren't being met.
Precisely. And verbal or emotional abuse might involve belittling, threats, or other uses of power and control by individuals, making the older adult feel fearful, worthless, controlled.
Recognizing these signs is the first absolutely crucial step toward getting help, toward intervention and protection, breaking the silence around this often hidden crisis.
Definitely. Okay, let's pivot slightly again. Building on overall well-being, maintaining both physical and cognitive health is just paramount as we age. It's foundational.
Absolutely. Our sources touch on general health goals that really emphasize the continuous need for regular stimulation for the brain. And this isn't just about preventing decline, right? It's about keeping cognitive functions sharp, fostering neuroplasticity, the brain's ability to adapt, and truly thriving.
Keeping the brain active.
Exactly. And what's fascinating here is a perspective offered by traditional Chinese medicine, or TCM. It presents a really nuanced approach to well-being that resonates with this idea of holistic health.
How does TCM approach it?
Well, TCM practitioners, they don't just look at isolated symptoms. They often tailor recommendations for mental health conditions like depression or anxiety based on a person's dominant element constitution.
Dominant element, like
Right.
fire, water, earth.
Sort of, yeah. It goes beyond conventional medicine's typical approach of maybe psychotherapy and medication. Instead, TCM considers an individual's unique personality traits, their energy flows, environmental factors. It's very personalized.
So what might they suggest?
A TCM practitioner might suggest specific changes to a person's diet, maybe their daily schedule, even how they interact with others, all tailored to nurture their well-being according to their specific elemental type. The goal is always to restore balance and harmony within the individual's entire system.
Interesting, a very holistic view.
Very. It underscores that true well-being is often achieved by addressing multiple facets of an individual's life and environment, not just treating isolated symptoms.
Okay, now let's turn to what feels like a really uplifting section of our deep dive, enriching life through engagement, specifically through hobbies, social connection, and even optimizing your living environment. This is where it really gets interesting, I think. Because aging isn't just about managing challenges, right? It's about embracing new joys and continuing to grow.
Absolutely. Shifting the focus to thriving.
So, hobbies, for instance, they go far beyond the typical stereotypes you might think of. You might picture seniors just knitting or gardening, and those are wonderful, don't get me wrong. But our sources reveal this vast array of interests that truly improve both brain and body health.
That's not just passing time.
Not at all. Engaging in hobbies can demonstrably boost your memory, your attention span, spatial reasoning, strategic thinking. Plus, they provide immense emotional satisfaction and, crucially, foster that social interaction we know is so vital for mental well-being.
So give us some examples. What kind of hobbies are we talking about?
Okay, let's look at some specific examples and their powerful benefits. Learning new skills is a big one. Think about local adult education centers, community colleges, university extension programs, or just the incredible wealth of online courses available now.
Lifelong learning.
Exactly. And the key, as experts suggest, is setting milestones or goals, something to help you stick with it. Why? Because the brain needs regular, consistent stimulation, not just a couple of days a month, to build and maintain those neural connections.
Like exercise for the brain.
Precisely. For example, learning a second language.
It's been specifically shown in studies to profoundly influence cognitive aging, keeps your brain more flexible, more resilient.
Okay, learning skills. What else?
And beyond the purely intellectual, consider the joy of crafting. Making greeting cards, for instance, it allows for incredible creativity, personalization.
Hmm.
It's a wonderful, tactile way to connect with people.
Something you made yourself.
Right. Knitting is another fantastic option. You can often do it while socializing, chatting with friends, and handmade items make incredibly thoughtful gifts, giving you a real sense of purpose and contribution.
Games are good too, Red.
Oh yeah, games. Board games like Mexican train dominoes or Catan offer fantastic mental stimulation and social interaction. They encourage strategic thinking, problem solving. Even jigsaw puzzles are powerful. Great for memory, attention, spatial reasoning, a quiet but challenging way to engage your mind.
And you mentioned challenging stereotypes.
Yeah.
Video games.
Yes. Let's talk video games. Forget the idea they're just for kids. Games like Stardew Valley or Animal Crossing. They can keep your mind sharp, foster social connection, promote strategic thinking, emotional satisfaction, all in a virtual world.
Interesting. Even physical games.
Sure. Even games like Wii Sports can get your body in motion. A fun way to incorporate some physical activity without it feeling like a chore.
What about more creative stuff?
Creative pursuits like drawing, even just simple sketches or doodles, offer a pathway for self-expression. You don't need to be an artist. Cooking is another incredibly creative outlet. The satisfaction of creating something delicious. Whether you follow a recipe exactly, adapt it, or just wing it.
Combining activities is good too.
Like outdoor exploration combined with artistic expression through nature photography. You get outside, enjoy fresh air, movement, and capture the world's details through a lens.
And for those who love intellectual challenges.
Genealogy. It involves fascinating detective work. Delving into family history, using online databases, old documents, creating a lasting legacy for future generations.
So many options.
Tons. All of these activities are really about staying engaged, staying vibrant, and continuously discovering new facets of yourself. It's about growth.
And speaking of engagement and contribution, volunteerism stands out. A powerful force for good, both for the community and for older adults themselves. Our sources powerfully highlight the significant and often underappreciated role older adults play in American volunteerism.
They really step up, don't they?
They really do. Here's a truly surprising fact. Even as volunteerism actually fell for all age groups between 2002 and 2021, the contributions from those aged 65 and older, they were comparatively resilient. Their share of total volunteer hours actually soared from 18.5% in 2002 to 28.6% in 2021.
Wow, nearly 30% of all volunteer hours.
Exactly. And what's truly remarkable is that this rise continued even through the pandemic, despite the significantly elevated risks COVID-19 posed for older adults.
And that's incredible dedication.
It shows incredible dedication, resilience, and commitment to community. And volunteerism isn't just about giving back, right? It also provides that crucial social connection and strong sense of purpose. It actively combats the isolation we talked about earlier and fosters a profound sense of meaning in later life.
That makes perfect sense. Okay, finally, let's talk about optimizing your living environment. A practical but powerful way to support well-being and independence as you age.
Yeah, our surroundings really impact us.
One surprisingly impactful step is decluttering. And this isn't just about tidying up the house. It's about freeing up physical space, yes, but also, crucially, freeing up emotional energy. Our sources even mention this idea of an energy priority scale hack for emotional burnout.
Energy priority scale, how does that work with decluttering?
The idea is that decluttering can feel emotionally taxing, right? Overwhelming. But if you do it strategically, maybe focusing on small wins first, it prevents you from getting stopped dead in your tracks by the sheer scale of it.
Breaking it down.
Exactly. You know how sometimes just thinking about tackling that overflowing junk drawer or that packed spare room feels utterly exhausting?
Oh, yeah. Analysis paralysis.
Right. Our sources shared a story about Mary from Maryland. She downsized from a pretty big house to a much smaller manufactured home and faced this mountain of over 40 years of accumulated stuff.
Yikes.
She said she had to strategically pick her battles, tackle small wins first so she wouldn't get completely overwhelmed. One surprising find for her, her 4 kids' old schoolwork. Mountains of it.
Oh boy, what did she do?
She neatly put it into folders, and when she gave it to them, they were apparently thrilled. They thought she'd tossed it years ago.
That's nice, a positive outcome.
Yeah, it's still a work in progress for her, but hacks like considering those just-in-case items,
Hmm.
the ones you could easily replace for under, say, $15 if you ever really needed them again, like extra tools or old linens.
Letting go of the just in case.
Right. It can help you free up a surprising amount of space and, importantly, mental load. It's about creating an environment that actively supports you rather than weighing you down.
And technology plays a role here too, doesn't it? Smart home tech.
Oh, absolutely. As technology advances, smart home technology is becoming an incredible asset for aging in place. It's truly revolutionizing what's possible. Things like voice-controlled lighting, smart door locks, automated heating and air conditioning, they offer tremendous benefits, both in assisted living settings and for independent living.
Making daily tasks easier.
Exactly. These technological advances directly allow residents to age in place longer. They make daily life significantly easier for folks managing conditions like congestive heart failure or COPD, reduces physical strain, increases independence, and what's more, from a professional care provider perspective, automating those rote, routine tasks with smart tech, it actually reduces pressure on nursing staff.
Frees them up for more important things.
Precisely. It allows them to spend more valuable time on direct patient interaction, providing personalized care, building those meaningful relationships, instead of being bogged down by mundane chores.
So what does this all mean for you, the listener?
It means really considering how your physical space can actively support your well-being and your independence, leveraging both thoughtful organization, like decluttering, and the ever-evolving power of technology.
It's about making your home work for you.
Exactly. So, wrapping things up, we've taken quite a deep dive today, haven't we, into the many facets of aging in America, from those significant demographic and economic shifts, the complexities of healthcare systems like Medicare, to the profound impact of social connection, the growing need for specialized geriatric care, understanding and preventing elder abuse, and even the simple yet profound joy of engaging in a new hobby or optimizing your living space.
It covers a lot of ground.
It really does. And it's clear that aging is a complex, often misunderstood journey. But it's one that is absolutely rich with opportunities. Opportunities for informed choices, active engagement, and maintaining a really high quality of life.
Yeah, if we connect all this back to the bigger picture, it becomes clear that aging isn't just some biological process ticking away. It's a dynamic, multifaceted journey. And is profoundly shaped by our individual choices, yes, but also by the strength of community support around us. Which really raises an important question for all of us listening. In a society that is rapidly graying, how can you leverage these insights we've discussed today? How can you help redefine what it means to age well? Not just for yourself, but maybe for those around you, your loved ones, your community.
That's a powerful question to leave people with.
And maybe consider this. What's one small, actionable change based on something you heard today that you can implement in your own life or maybe for a loved one? Something to foster greater well-being and a richer experience of aging. Because the power to shape this journey really does lie in informed action, taking that first step.
That's a perfect thought to end on. Thank you for joining us on this deep dive into aging in America. We sincerely hope you feel more informed, more empowered, and maybe more curious to navigate this universal experience with confidence. Keep exploring, keep learning, and we'll catch you on the next deep dive.